So today we will discuss how we can differentiate penicillium. Okay. So first point, you want to know whether it is in septate or aseptate hyphae. So penicillium, it has some septate hyphae. Okay, though there is a septum in the hyphae. So from this septum arises a conidiophore. This is a conidiophore which give rise to a medullae. This is called as a medullae. And then which give rise to phyllodes. So there can be a 2 to 3 rows of phyllodes. From then the conidia usually arises from the phyllodes. So just remember, it is a septate hyphae. Conidiophore arises from the hyphae which give rise to medullae. The medullae in turn give rise to phyllodes, and then conidia will be arising from the phyllodes. So this is typically a paintbrush appearance. So like this, right? So see. So this is called as a paintbrush appearance. So penicillium in LPCB, it will be appearing like paintbrush. So here the colonies will be, a penicillium colonies will be greenish powdery consistency. Okay, whereas there is a species called Penicillium marnefi. You want to same, it has the same microscopic features like septate hyphae, conidiophore, medullae, phyllodes and conidia. But there is one difference, that is you can remember like A, B, C, D and E. So A for amphotericin, it's a drug of choice, or itraconazole. And B for, it produces a brick red pigment in the colonies. C for, it has a conidia. The route of infection is inhalation of the conidia. And D for, it is a dimorphic fungus. That is yeast growth at 37 degrees Celsius and mold at 25 degrees Celsius. And E for infection. Okay, you can remember like infection. It is the most common cause of infection in AIDS and immunocompromised patients. That's all. So you just remember A, B, C, D and E. So Fusarium. So first coming for morphological appearance, that is the colony appearance, it will be like a whitish velvety in color, but there will be a slight pinkish in color. You can easily identify that. Okay, so the colonies will be somewhat light pinkish in color, and then here it is in first point septate hyphae, and it will be producing a macroconidia and microconidia. So macroconidia, it will be like sickle shape. Okay, like this, or it can be like this. So if you are seeing a sickle shaped macroconidia, you can make it out Fusarium. And then there will be a small round microconidia will be there, and there will be also chlamydospore. So these are a least differentiating feature. So main thing is, if you are coming across this sickle shaped macroconidia, you can label it as Fusarium, and the colonies will be somewhat white and pinkish in color, and there will be microconidia and chlamydospore. That's all. Thank you.